Hi, I'm Bruce Copley, Director of the Department of Alcohol and Drug Services. I want to take a few minutes to explain the services that our department can provide your patients who are pregnant and a bit about the system of care we have, as well as what we believe to be important elements of looking at the patient's use of drugs and alcohol during their pregnancy. In our department, we have a 1-800 number. That's our gateway call number. It is available for patients, clients to call and to schedule appointments, primarily in our outpatient or our residential system. If a patient is pregnant, that individual will have a priority in terms of being offered services. Typically, that person will be offered one of our perinatal outpatient services. We provide long-term support for the mother while she is pregnant and provide up to a year of support after the child has been born to assist in the parenting skills necessary for that child to develop appropriately. Along with the perinatal program, we also have a residential program for mothers, and that provides services between 6 and 9 months. Up to 3 children can come with their mother who is addicted and stay with the mother while she is recovering. At the same time, we are providing child care, assessment of the child's developmental needs, and assisting in ensuring that that child is developing appropriately or providing the interventions necessary to bring the developmental cycle up to where it should be for the child. Also, we have a program for women called the Mariposa Residential Program. That is for women on their own. It's a 45 to 90-day program. Again, it is addressing either alcohol or drug abuse. When they are discharged from that program, they are then offered outpatient services. Again, we're looking at providing case management and the initial support services necessary to have that woman back in the community, connected with the family, and at the same time also ensuring that they're connected with their primary care physician. The important element to all this is that we identify early in pregnancy if a woman is using drugs or alcohol. We know that between 13 and 15% of women are smoking during pregnancy. Another 12 to 15% are using alcohol at some level, and about 5 to 8% are using drugs. Obviously, all of those can have serious impact on the development of the fetus and in terms of birth weight and early termination of pregnancy, as well as just the stability of the fetus once born, and importantly, to identify then what are the interventions necessary in terms of parenting and skill development for that fetus so that the fetus can develop normally. Again, the critical thing for a physician is to ask the questions. I know you're busy, and you have a lot on your plate, but a physician and their patient, it has been proven that if the physician asks those questions, patients typically will acknowledge if they have a problem. The next step is then to encourage that individual to call our gateway number. Again, they will have priority. If you have questions, you can always call our perinatal program. We have physicians on board that can address any questions you might have as to the complications you're seeing with your patient. And the important thing is to get them early in treatment and assist in maintaining them in treatment through their course of recovery. Thank you.
Your next step is to make a referral for an assessment with a professional. In Santa Clara County, Gateway is the Department of Alcohol and Drug Services managed care system. The patient will receive an appointment for an assessment with a treatment professional. If possible, encourage the patient to make the appointment while the patient is at the office to keep an ongoing interest in the problem.